We have an opportunity now to ask the panel or individual panellists questions or to make comments about the presentations that you've just heard.
The real problem, I guess, when it comes to aged care is the logistics of transportation, and having that facility on site certainly will be a great benefit to your clients, and I hope it's released on a national basis and we pick up that model of care. When you were talking about the dentist coming in on a part-time basis, I was in my mind thinking, is that dentist there on a full-time capacity? And you said no. So I would encourage you, based on your statistics for the me and the moo, excuse me, that 73% of your clients are either partially or fully edentulous. So engaging with the relevant bodies like the Australian Dental Prosthetists Association or your local dental prosthetists, I would encourage you to have them as part of the team, excuse me, helping to facilitate that care within your facilities. Thank you.
One of the things when we were doing the sort of plenary work, a couple of things were raised to us. The first thing is that the major barrier for people accessing care or actually treatment was transport, and the second was the capacity for the dentist to be able to manage their frailty and sort of care needs associated with that, or their staff to be able to manage what was required to get people in and out. And so that was a big issue, and and it did take us down that pathway to look at dental services as being the one. The other thing is that when we've been looking at the dentist and whom it is that might be interested, many of the dentists have identified the prosthetist as being an individual. This is probably the one area where our residents actually see the person that's been looking after their dentures forever. But increasingly, people are coming into the facilities and moving outside of their own home area, and it's just not convenient for them to be going backwards and forwards, and increasingly they're not able to actually get the prosthetist to visit. So in a sense, we needed to address what the reality might be. We also did a bubby survey, and I say bubby because we only surveyed about 40% of our residents from both sites, was we looked to see would they come to visit a dentist that was on site. 100% said yes. It was actually about getting to the service, not necessarily about retaining the relationship that they had in the long term. So that gave us a little bit of added impetus to carry forward.
The vast number of these people have dentures, and dental prosthetists, that's all they do every day, all day. And none of these slides mention that. So I'm just wondering with Lynn as well, the cleaning of dentures, the maintenance of dentures, that's all part of a dental prosthetist's life. They should be included in this discussion.
I just like to make a comment. I think that the last talk we had, the difference between the 50-odd or 60-odd people or 90-odd people who needed care the first time and the 3 that needed the care the second time just emphasises what Clive said also, that it is the daily care that is absolutely critical to long-term retention of healthy teeth. And so everyone should, I guess a lot of people are involved in this area, but everyone must be aware that that is the absolutely critical thing, to understand the high risk that old people are at because of low salivary flow and inability to brush the teeth effectively and so on and so forth, and really put that effort in that area. I mean, that is the critical area. I think having a dentist visit on site is fine, providing it supports very much the underlying preventive approach of the rest of the health team.
Hello, I'm Sharon Liberale. I'm a special needs dentist, and it's an area I've worked in for a long time. And one of the key things I'm finding, and I have found all along, is that in these aged care facilities and residential facilities and with the disability services, there's a huge turnover of staff. And the other thing I'm finding is that the staff that are caring for the clients don't have a huge amount of oral health information themselves about their own oral health and about how they need to look after their own teeth. So the best way I found to manage that was actually to educate the staff. So to actually congratulate, I think it was Dawn that talked about the fact that their staff would have access to the dentist as well, because what I'm finding is those staff actually don't have the knowledge base themselves and are applying their limited knowledge base in a very, very difficult environment. So I would actually perhaps give you a little hint that maybe when we're looking at improving the the oral health promotion and oral health literacy of our workforce, we actually look at the whole population as well. Because when you speak to people, most people don't have an understanding of the links between oral health and general health. They don't have an understanding of the links between oral health and oral hygiene. They don't have an understanding of the links between oral health and diet. They don't have the understanding of the links between oral health and quality of life. And we need to consider all those things for the whole population and not just for the workforce. And then we'll find that in a generation's time we're not having to do this to the same degree. I'd just like your comments on that.
Margaret, can I just respond to that?
Yes.
Yeah, I just wanted to say that part of the result that's come out of this project is that the workers have actually been speaking about the fact that they've improved their literacy and that they've actually had a different view of their own families in relation to that. So it's a very valid point, and I've got to say that even I thought I was pretty good about how I looked after my own teeth, and I was raised in a town that didn't have fluoride, so they're not that great. But I've just learned so much over this year that I had no idea about, so I take that on board totally, and I think that that is one of the results that we'll have by just raising the awareness all up.
Though it's a nice presentation, however, this is still just one day's worth of training, and the jobs that these carers, whether they happen to be DAs or carers, will be doing will be a hands-on skill, and you will not learn that in one day. And I will stand by and wish to see it actually done. One day to absorb all that knowledge from someone who's actually a qualified trainer and understands how people learn, that is impossible. And we've got to keep, yes, if it was, say, one day, next week another day, keep focusing in your mind. You will not learn how to play a sport. You will not learn how to throw a pot and understand the dynamics of creating clay. Whatever activity you have in one day, chances are by the first half of the day you will be struggling to understand your own oral health and the skill strategies to go through. Yes, there will be an improvement after one day, yes, but aren't we aiming to have someone who has knowledge higher than what they need to implement in the facility? If we all work at the cutting edge of the knowledge that we have, we would all live a very stressful life. We overlearn so we can come back and work in our comfort zone. We need to be skilled to work in that. You've got a duty of care to do that in the workplace. That's very important.
Thank you, Clive. Look, I might just take the opportunity here to quickly make a point about competency-based training and why we're going down the path of writing competency standards. And by bringing this into the vocational education and training sector, what we're doing is taking advantage of an existing framework where when people are trained, they're not trained according to a training program. They're trained according to a workplace outcome that is specified in a competency standard. And the idea is that when people are trained, it takes as long as it takes in order for them to achieve the skills and knowledge that are required to consistently demonstrate the competency that is described. Now, when we get to the point of writing competency standards, we'll need a lot of input to make sure we get it well described so that we don't fall into the trap of, on the one hand, providing too much knowledge and skill for a simple task or not enough knowledge and skill for a more complex task. And that's what we'll be dealing with next. So we look for your input when we get to that point.